Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
The following programming is furnished by you and your doctor.
The content, information, and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back, everyone, to yet another amazing episode of You and Your Doctor, sponsored by All County Healthcare. You're able to listen to us on 96.9 and 95.3, and you're able to watch us on amp2.tv. I'm your host, Raymond Phillips, and today we have another returning guest with us today, Dr. Zaki. How are you doing today, Dr. Zaki?
I'm doing quite well, thank you.
Awesome. I know we're all very excited to have you back on the show again, becoming a little bit of a regular now.
Indeed.
And for our listeners or viewers who are tuning in tonight, Dr. Zaki is the owner of Moyenda Medical Associates. He is a board certified in family medicine. His practice is located at 220 South Dixie Highway, Lake Worth, Florida. And you're able to reach them at 954-774-1414. Oh, I am so happy to have you back on the show, Dr. Zaki. It is always a pleasure.
Thank you so much. Pleasure to be back, man.
Awesome. So for
team at All County, I know we may have a little speech delay, but I want to plug that in. Thank you to the whole team at All County.
Perfect. And you know, All County, we always thank them because they are the ones who sponsor the show and bring on amazing doctors week after week. So always give them a round of applause for sure.
Yes, and it helps us a lot too because we're insulated seeing patients. We kind of live in an isolated world, so this gives us an opportunity to spread out a little bit so community get to know us. So we appreciate that.
Definitely. Absolutely. So Dr. Zaki, for our listener viewers who have not seen you or heard you yet, do you mind explaining a little bit about yourself as well as your medical background?
Sure. As you mentioned, I'm board certified in family medicine. I recently opened up a primary care office in downtown Lake Worth, but the background has basically been taking care of critical care patients in hospital setting for the last 7-8 years. And so we had been taking that experience as well as our philosophy of our patients are priority one into the primary care setting. So we're excited about it. Those people who know me well know that I take the patient care setting very seriously. And we know if you have your health, you have everything. It only takes one illness to put you down to realize just how valuable your health is. So as healthcare professionals, doctors, nurses, and the like, this is our calling. And so this is what we're offering. And we're doing it in such a way that we don't treat our patients as numbers and as only financial tools, if you will. And we're taking it a step further and implementing ways that we can prevent things that are preventable, such as obesity. We're doing a campaign now on our Instagram page where we've been taking separate topics about hypertension, stroke prevention, colon cancer, etc. And now we're on the topic of obesity. So we're going beyond just having patients come in when they're ill and trying to treat them, give them some medicine and say, see you next time. We want to say, what can we do to make you feel better? What can you do to make yourself feel better? Because health is a holistic matter.
Absolutely, absolutely. And, you know, it is so refreshing to hear a medical professional talk about the holistic view of just your overall health and well-being, because as you know, there's no one specific area that can, you know, keep you from getting sick. You have to make sure that you are living a nice and balanced life.
Absolutely. Yes. As much as we can.
As much as we can, exactly. And before we get into the topic of obesity, I also want to highlight Dr. Zaki because he was recently featured in the Boca Raton Observer. So congratulations for that.
Thank you very much. It's not just me. They have physician profile section, so I'm honored to be on there and profile our practice.
Well, we're going to give you your congratulations where it is deserved. That was a little bit of a tongue twister right there.
Thank you very much.
You are very, very welcome. And so moving forward in the interview, obesity. It's one of those things that I personally like to call almost an epidemic, especially within the United States of America. And there is so much behind obesity, both the physical, the mental, the nutrition side of it. And it can be overwhelming to a lot of people at times. So at Moyenda Medical Associates, how do you combat people who are chronically dealing with obesity and other, you know, medical conditions that may come along with it?
Well, first thing is education, getting people to know that this is a problem, this is a disease, and letting them know that there's a cost to it, there's a financial cost to it, there's a social cost to it. You miss work, there's so much. The cardiovascular system is bombarded. The heart doesn't coincide when the body does. So if you go increase your body size 2 or 3 times, 4 times, if you will, the heart is still the same size. It's still now it has to work that much harder. And so we start with these basic principles of education and making kind of shocking the mindset as to we can't just take this as I'm big boned, or this is just I've always been fat, and just keep going. You have to take this serious. And so that's the first thing. And then as we do that, we try to get their mindset in a way that will translate into making better decisions regarding dietary choices, regarding portion size, regarding exercise, because it all emanates from the mindset. You can start a weight loss program, you can start a diet, you can go to your doctor, you can even have bariatric surgery. But if the mindset has not been fixated in the proper way, then all those modalities will not be fruitful. And so we try to start, and that's where we're trying to make the most impact.
That is so beneficial, especially to the South Florida community as a whole. And it's really amazing to see what you're able to do with your practice to not only help with people's day-to-day medical needs, but to also educate them and to teach them how to better take care of themselves as well.
Yes. And can I say one more thing as we talk about obesity?
Of course.
Carve out a subsection of that in childhood obesity. As adults, sometimes we weren't obese when we were children, but we made bad decisions as adults, and we have to own up to that. But to see children that are obese, morbidly obese, before the age of 10, there needs to be some kind of initiative, real nationwide initiative to address this. I know when I was in school, elementary school, they had things, presidential awards and things. We used to have to go out and run a 50-yard dash, and we were very, very active.
Yeah.
So to see children walking around with that excess weight, that their body hasn't even had a chance to develop properly, that's not talked about enough. And we want to, even though we don't treat children in our practice directly, it's still something that impacts the family.
Absolutely. When it comes to someone's health and well-being, it is a family's matter because, it's not just you who is affected, it's the entire family who's affected. So moving forward, I actually have a question for you that I feel like you'll be very fit to answer. I know food culturally has such a important aspect in our lives. And growing up in the African American community, I would see culturally more and more kids, younger and younger, experience symptoms of pre-diabetic or who are also obese. And a lot of it has to do with the foods that we're consuming on our day-to-day basis. So For you, how do you deal with, the cultural aspect of food and the relationship that your patients have with food themselves?
That one's a little bit difficult because now we're moving more into social behaviors in an isolated fashion, where in the clinical setting as a physician, I probably wouldn't be able to have much impact on that.
Okay.
If, for instance, the patients are coming to me for a clinical medical reason, and I would try to sneak in the back door if there's an obesity issue there, or
Yeah.
I'll mention, for instance, I used to work as a residency coordinator for pediatric dentistry, and so in Las Vegas, and that's when I realized how many children, because of the bad diets, had poor dentition, and so oftentimes we would look into the mouth, and then basically what I'm saying is we use the clinical setting to educate about other social settings, other.
Okay.
That way, we're not crossing boundaries, and we can make the connection to the healthcare setting. That makes sense.
Well, thank you for that. Definitely. So again, following up on the topic of obesity, I see here that you deal with a lot of hypertension, diabetes, as well as COPD and asthma. So are those common things that obese patients deal with on a day-to-day basis?
Yes. In fact, one of the first posts or presentations we had on our Instagram page was something we call a metabolic syndrome, which is basically a summary of increased abdominal girth, if you will, sedentary lifestyle, increased cholesterol, which leads a lot of times to insulin resistance. It's like, diabetes will. And then when you have diabetes, you have poor circulation. So all these things in sedentary lifestyle, lack of working out, the heart is not pumping, poor diet, you can see there's a cycle. And so we try, again, it's all about education and knowledge, explaining in very simple fashion how this leads to this and this leads to that. And if you don't fix it, this is what's going to happen to you. In very simple terms, it's not rocket science. It can be very complicated, but if you tell someone if they don't eat properly or take their medicine, they're going to go blind or lose their kidneys or perhaps have a heart attack or stroke, it's a different conversation.
Wow. It can be very overwhelming sometimes to hear about how many people suffer from this. But again, I'm going to say it again, reiterate again for our listeners and viewers tonight. Again, it is so refreshing to have someone like you who is willing to educate not just the patients that come in, but the community as well. I know that you do community work as well.
Yes, and if I may say so, before we get into the community, again, I have to stress blood pressure. In the short time we've opened, we've had random blood pressure checks from at least 5 people that are almost in the 200s and they didn't realize it.
Wow.
This is very, very common. So if you, again, anyone out there, if you know you have high blood pressure, maybe you haven't gone to the doctor, go and get your blood pressure checked. You save yourself the trip from the emergency room, save yourself from possible stroke or heart attack. I can't tell you enough people are walking around with high blood pressure. And they call it the silent killer for that reason. So regarding our activities in the community, we are the proud sponsor of a soccer team here in West Palm Beach. And so with the World Cup just finishing, there was a lot of buzz in the community with soccer. And so we were able to join forces and provide uniforms to one of the teams.
Oh, wow.
And our staff is engaged and it's given us opportunity, for our families to come and meet with them. Even though we're a small operation, again, we're thinking in the future. It may be small, but our antennas are going to slowly branch out into the community and continue to do so.
And that is the way to do it. And I actually want to go back and follow up on the hypertension point that you make. And for our listeners and viewers who didn't know, don't you offer, people in the community to come in and receive, be able to get their blood pressure checked at your clinic?
For free.
Absolutely amazing.
That's how serious it is that we are about it. And the next thing I'm also going to mention is that we're going to be, there's 2 local pharmacies in the area. One of which I have a connection with a friend of mine actually owns a pharmacy who's going to agree to give us some hypertension medication for free. And so that if we have those patients that come in who have no insurance, who have limited ability to buy it, they'll be able to get their medication. Because I believe sometimes also there's a financial barrier. People
No,
know
absolutely. Yeah.
they don't have insurance, and they say, "Oh, I don't feel that bad. Let me just go on without it." And again, without the knowledge, we have to explain it to them. And so we're happy to have people come in at any time, have their blood pressure checked, and soon we'll have medications available to give right on the spot.
Again, absolutely amazing what you're doing for both your patients at the clinic as well as the community that surrounds yourself as well. But we are going to be taking a quick commercial break and we'll be right back.
All right.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back, all of our listeners and viewers tonight, to yet another episode of You and Your Doctor, sponsored by All County Healthcare. Again, today we have our very own Dr. Zaki on the show again tonight. We are always very happy to have him. Dr. Zaki is the owner of Moyenda Medical Associates, and they're located at 220 South Dixie Highway, Lake Worth, Florida, 33460. And you're able to reach them at 954-774-1414. Welcome back, Dr. Zaki. I know it's a huge, long commercial break. It's been forever.
Right.
Well, so for our interview now, I almost want to switch directions a little bit, because the first time you were on our show, you haven't even opened your practice yet. You're about to have your grand opening, and I believe it was the next day. So tell us a little bit about how your practice has transformed and grown since your first time being on the show.
Thank you. Well, you're right. We've come a long way in a little bit of a time. It's been busy. Picking up slowly. Updates include being on the panel with the contract with the Florida Blues. That was huge.
Congratulations.
Thank you very much. That's an accomplishment for us. I think we mentioned at the first show that was one of the barriers for primary care offices.
It was.
Payers. We sort of drive the market in terms of the financing. So we've just getting that contract. And as you know, we're currently in open enrollment now for most folks. We've seen a big increase in our patient population base. So we're happy with that. We've also had increased walk-ins. And the other thing I wanted to mention is, we have a concierge sort of component to practice where I personally would go out and do home visits, particularly for the geriatric population who may be homebound and want a personal physician to see them in their home setting. And so with that in mind, my plan was to extend the hospital privileges from here in JFK, where I currently have hospital privileges, further north to Jupiter. So I'm happy to say that I have temporary hospital privileges there over the last week. And I want to announce that there's any patients in that area in Martin County who need a primary care physician. I'm around. You can find me. And in the event that you get admitted to the hospital, you're going to be able to follow them as well. So those are some things.
Well, I just want to congratulate you for the growth of your business, because I know it's definitely not easy. I know there's a lot of hard work going in behind the scenes. And I would say your article in the Boca Observer definitely, you know, highlighted all the hard work that you personally have been putting in, as well as your fellow, you know, co-workers as well at your office, to really help to just grow the business as a whole.
Right, and that's very important. You know, there's that whole thing. One hand cannot clap.
No,
So,
no, it cannot.
Lots of help, lots of good support, and I'm grateful for that.
So describe the relationship that you have with the coworkers at your practice and almost the culture of what is going on there.
Well, good question. That really happy to share, because the people that I have directly working with me and everyone that works with us kind of indirectly, they know it all emanates from the philosophy that we have towards taking care of our patients. And so that philosophy is that of family orientation. You know, we have to imagine that's our family member that's there, you know, and so act and think accordingly. And that's a that's a high bar to set, but the results speak for themselves. And that's what we saw. The patients don't need anything less than that.
Absolutely.
And so that means that everybody that intends to work with us kind of inherently has to follow along with that. And then from that, then you see the family atmosphere. You know, we get along as family. And that's what I'm trying to produce, and that's the way it's going to be. Because if that's the way it is with us, it's going to emanate right on to the patients.
No, absolutely, absolutely.
We've seen that already. Actually, we've had 2 patients come in, and they were so happy, to male patients, and as soon as they left, they referred their wives to come back to be for us to be their primary care doctors.
Oh, that's truly amazing. I'm very, very happy for you, as well as everyone who's putting in all the hard work at your practice over there.
Yeah, thank you.
Of course.
Oh, one other thing I want to mention, we also mentoring medical students and nurse practitioner students.
Wow.
So they can come. We've had one medical student that came along with me in the hospital as well as in the office to, you know, shadow. We also have a nurse practitioner that'll be joining us next year, January, next month.
Wow. Well, they'll be learning from the best for sure.
Thank you.
You know, one thing that I always tell my clients is that I don't take it lightly when you trust me with your health and well-being of your body. And I can see that over at Moyenda Medical Associates, you view the same thing, because if it was your son or your daughter or your husband, you would want them to have the utmost amazing care, top-notch care. And why doesn't everyone else deserve that? Because this is the only body we have. We don't get another one.
Right. Absolutely true. 100.
So are there any new things or new projects that you're working on over at Moyenda Medical Associates?
We have the vitamin supplement. Time has been slipping under my feet. We're waiting to get some personalized vitamin supplements available to our patients. And those other things we mentioned, some things we don't want to mention, but we're busy.
Well, my mom always said busy is job security. Not very catchy line, but it is very correct. So now whenever I think that, I'm getting so busy inside, you know, I'm like, it's so much better than not have any clients or patients coming in at all. So I'm very, very happy for you. And I know that you feel probably very blessed and thankful for the opportunities as well.
Absolutely. Yes.
So as the show is coming to a close now, do you have any last minute remarks to our listeners and viewers that you would like to share?
We are not hard to find. Downtown Lake Worth, 220 South Dixie Highway, Lake Worth, 954-774-1414, at Moyenda Medical on Instagram. And if you care about your health, come to us.
You heard it here first, guys. Head over to Moyenda Medical Associates and please, please, please go ahead and follow them on Instagram as well. There's daily tips for your health and your well-being that's posted every single day on their Instagram. So you just click in, you can get your health fit for the day. Absolutely amazing. I know I watch it myself, and I look forward to seeing everyone next week for another episode of You and Your Doctor. And I just want to thank again Dr. Zaki for coming onto our show tonight. I hope everyone. Of course. And again, it is always our honor. I hope everyone has a great evening tonight, and I'll see you next time.
All right.